My name is Dr. Trevor Nichols, and I'm one of the dentists at Brennan Dental here in Chandler, Arizona. I'd like to take just a few minutes to introduce to you the topic of dental implants and discuss a little bit the background and costs that are involved. There's lots of different types of dental implants on the market right now, and they can be used in lots of different ways to solve problems from missing, broken, cracked, and loose teeth. If you're suffering from one of these issues, you've probably asked or wondered about dental implants and if they work for you. One of the most common things that we get asked as dentists is, how much do dental implants cost? It can be a little frustrating for us because it's almost like going to a car dealership and asking, how much does a car cost? We all know that there are probably cars on the market and they're priced a different way because they offer different things. How big they are, how fancy they are, etc. Probably the first thing the salesman's going to ask you when you walk on the lot is, what type of car are you looking for, right? Maybe you're looking for just a regular economy car to get you from point A to point B, or maybe you're looking for the most luxurious sports car on the market. No matter what, there's always going to be variability on the cost. Dental implants are kind of like that. Not only are they priced by what application they're used for, but they're also priced based upon the size, how many are needed, warranties, and even the skill level of the clinician or type of dentist who might be placing them. The other thing that varies and becomes part of the whole equation is what type of restoration or appliance is being created to hold the tooth in the implant. There are lots of different materials being used right now. There's acrylic, PMMA, zirconia, porcelain, titanium, nanoceramic, the list goes on and on. Generally speaking though, implants can have a range of price between $2,000 and $50,000. And yeah, I know you're thinking, did he just say that? And yeah, I get it, it's expensive, and it can be, but let me tell you how a recent patient of mine looked at it. He said the two words he found most unpleasant when talking about money is expensive and cheap. Expensive means that it's something I want, but it's out of reach, and there's no hope for getting it. And cheap usually means cheap, right? It doesn't have much value, or it's secondhand, or little value. He told me the favorite word that he liked was affordable, because affordable means that even though it might cost more than something cheap, it's possible to have it, and affordability provides hope and creates value. One of the things that we focus our business on is helping to make dentistry affordable for people. It wasn't very long ago when patients couldn't afford, or people couldn't afford to buy a $500 cell phone, and now you can't really find anyone that doesn't have a $5,000 or $6,000 or $1,000 iPhone. Not only do parents have it, but sometimes even kids have it. And why is that? It's because companies have made it affordable. By paying for that over time, it becomes an option that for some would have been out of reach, but now is within reach. It's the same for cars and appliances and jewelry and other things that we use on a daily basis that are financed over time, whereas only a few years ago, this was a lot less common and maybe not even doable for some patients. And I get that not everybody wants to finance their dentistry. That's okay. There's always something to be said about managing money, but oftentimes it becomes more expensive to fix things by putting them off or procrastinating. And often your dental options may even disappear. Sometimes we need to just sit down with our clients and find out how we can help them and how their dental needs can be fit into their budget. So the other question always is, with insurance and Medicaid and Medicare, what's being covered by these insurance? And to be honest, it really does depend on the type of policy that you hold and what your limitations are. But the best part is that we have someone that can handle that for you when you come to our office. However, when it comes to Medicaid and Medicare, unfortunately, these government-sponsored programs don't set aside funds for dental implants. So even if a dentist does cover or accept Medicaid or Medicare, they're not going to get dental implants. Hopefully one day soon our government's healthcare system will realize the benefit of dental implants and how they can help patients to live longer, healthier, and more productive lives. So to kind of wrap it up, dental implants aren't cheap, but they don't have to be expensive. In almost every situation, dental implants are valuable. They're changing lives for the better. Better chewing, better health, and a more attractive smile. To find out more about dental implants and the other options that you have in this rapidly changing world of dentistry, come in for a free consultation.